Organizations are calling on young people to stay away from nicotine and tobacco to keep their lungs and bodies healthy. The National Council Against Smoking, NCAS, the Cancer Association of South Africa, the Heart and Stroke Foundation South Africa, and the Alcohol, Tobacco and Other Drug Research Unit of the South African Medical Research Council are amplifying the Protect Our Next campaign. The drive reported exposes the secrets of the tobacco companies as they call on government to pass stronger legislation protecting the youth from tobacco industry. Joining us now is the Executive Director, National Council Against Smoking, Savera, Kalideen. A very good evening to you, and thank you so much for speaking to us. So you say there are secrets. Let's start by unveiling those.
So World No Tobacco Day is an annual day declared by the World Health Organization to focus on tobacco-related harm, and there's a different theme every year so that the education changes from one year to the next, and the body of evidence that is gathered each year is able to be shared for the next year. So this year, as you rightly say, the theme is to protect young people from the manipulation by the tobacco industry, the e-cigarette or vape industry, and other related industries, as well as to keep them away from nicotine and tobacco addiction. So what is actually meant by that is that, for example, South Africa, we have really great legislation, and our legislation is more than 20 years. And what we've seen because of this legislation that, for example, bans all marketing, advertising, and sponsorship, is that young people, in fact, the entire population, is protected from any kind of marketing, except at the point of sale of the tobacco product. However, when our legislation was introduced 2 decades ago, there was no social media. So now what these industries do is they use social media to market their products to young people. And we all know that it's young people that are mainly on social media. So they also get influences from celebrities, from the arts world, from radio DJs, television drama stars, movie stars, and they fashion icons or beauty queens even, and they enter into contracts with them. And so these so-called influencers will attend launches of the e-cigarette industry or the vape industry, or they will go to a fashion show, and they will tweet from there if there is a stand of a tobacco industry there advertising its products. And that is how, through this form of indirect marketing, they're actually trying to coerce a new, younger generation to experiment with their products and then, of course, become long-term users.
Let me jump in here just a moment. Yes. You speak about a conspiracy. You talk about the fact that the tobacco industry is using all kinds of attractive levels to lure the youth. They would counter that by saying that they follow all protocols, having labels that are attached to their products, the warnings that they've even ensured that the products themselves, if you talk about cigarettes, ensured that the tar levels are lower. And if you talk about the dangers of fires, for instance, they've put in mechanisms to ensure that cigarettes are put out after not being puffed for 2 seconds or so. So are you really debunking myths and exposing manipulation, or are you just countering the industry itself when it says they are putting in place measures to protect smokers?
So that's great that they're putting. It's great that they're putting in place all of these things so that there's no fire when there's a cigarette that's lit. But they can't put in place anything to stop the health harm, to stop the dozens of cancers that people will get if they smoke cigarettes, or the increase in respiratory illnesses like asthma and bronchitis, or the cardiovascular diseases that people will get. And the reason that the tobacco industry and these related industries have to target young people is because globally 8 million people die every year. And for industries to survive, they need a new generation of consumers. And that is why they are trying every other strategy outside of the law. You were saying just now about cigarettes having the ingredients and the warning, and that's true. However, e-cigarettes are sold all over the country without any regulation and without the list of ingredients in that vape liquid or the e-cigarette liquid. It doesn't tell us what impact it will have on the human body. It doesn't, and they mask the taste of the tobacco and the nicotine with over 5,000 flavors, like chocolate donut, like cream soda, like Coca-Cola, because they know that young people do not find the taste of tobacco palatable or the vape liquid palatable. So they have to mask these tastes so that they get people to try it.
So you had consultations last year in August to strengthen legislation on tobacco products. So how far are you? And as we go into this COVID-19 period where we're trying to discourage people for smoking, saying that it is a danger to your health, especially because of respiratory dysfunction, why was it not ready to be implemented at this time? As in, what have been the barriers?
Okay, so that's a great question. So the Control of Tobacco Products and Electronic Delivery Services Bill was released for public comment 2 years ago. Government got over 25 to 30,000 comments, they told us, and they were in the process of integrating all of those comments into a new draft of the bill, and we understand that that is ready. The COVID-19 pandemic has interrupted the work of Parliament, as well as many of the committees of Directors General, FOSAD, that the bill has to go through before it can actually go to Parliament. But we've been assured by the Deputy Minister of Health today at a World No Tobacco event held by the Department of Health that Parliament will begin its work in a week or two, and the bill is going to be very high up on the priority of the Department of Health to make sure that it moves very, very speedily. The other thing that we spoke about today is that during the lockdown, we heard from UCT that more than 800,000 people, I beg your pardon, more than 800,000 people stopped smoking during the lockdown. They have obviously heard the health messages linking tobacco consumption to increased risk of accelerated COVID-19 disease in those that contract it. And they also know, of course, all of the other health harms that I've just been talking about for tobacco that is a result of tobacco consumption. So many, many hundreds of thousands of people have stopped smoking. But to go back to young people just for a few more minutes, a study has been done about the prevalence of smoking in movies designed for the under 13s. And they found that 50% of the movies that are targeted at children under the age of 13 have 1, 2, up to 20, 50 scenes of people that are smoking. Now, if you are saying that you're not targeting your product at people who are too young to smoke, and you don't need to use subliminal advertising and product placement to get a new market. Why are cigarettes being and smoking so prevalent in movies that are targeted at the under 13s? Because usually the themes for those movies don't have that kind of, people going into bars or, teenagers being in parties. This is under 13s we are speaking about. We're speaking about movies like The Nutty Professor, like Honey, I Shrunk the Kids, like Ant, like A Bug's Life. These are all really, really child-oriented movies, and yet they have this. And it has been found that many of the tobacco companies are paying filmmakers and distributors to place these products in their films. And way back in 1983, the Philip Morris international director said that it makes him absolutely happy to see more and more leading ladies more and more heroes in movies walking around with a lit cigarette. And
now, I want to talk about earlier on, obviously you had various stakeholders in the forum that we saw earlier on, hosted by the Health Department. And some of them are saying, as adults, it is their choice to smoke, and therefore they do not see why they ought to be dictated to on when and how to smoke. What is your response to that?
Well, there's no dictation. What we have is legislation. The legislation says, you know, that if you want to smoke, you can smoke as long as you are not smoking in an indoor public area, or you're allowed to smoke in a designated smoking area, which currently is 25% of indoor public areas, or outside as well.
So you mentioned the ban earlier on, and how positive it's been that you've had more and more people quitting smoking. So if you have a ban on cigarettes, is that not dictating to people whether or not they can smoke? And I'm not saying that this should be apportioned to you and that it's your decision as campaigners, but the concept itself of a ban means that you are denying a person a right to choose.
Yes, I mean, that's an interesting point that you're raising there. So remember, we are living in extraordinary times right now. We are in the middle of the COVID-19 pandemic, a virus that was not discovered even 5 months ago. And the country was put under lockdown with very short notice. And the majority of manufacturers and producers of all kinds of products were asked not to work. Only those that were producing or distributing food, medicine, were essential services like the media and a few others, probably you know, internet connection and telephone and stuff like that. So this temporary ban is not linked to our legislation in any way whatsoever. This temporary ban is linked to the pandemic of COVID-19 and the decisions government has taken about how to address the pandemic. So you know, we were given some notification as the South African public that this is how our lives are going to change during the time of the pandemic.
Ms. Kalideen, and I understand that it is not of your own volition, and I think I already made the point that you have not yourselves enacted the ban, but obviously you do support it. But let's move on to other things. The issue of sale of single-stick cigarettes. Why do you have a problem with that? We're just showing visuals now of somebody who had gone to, obviously, those informal vendors and bought single-stick cigarettes. People are saying, whom we've asking how they're managing their smoking habit, and some of them are saying they're sticking to buying a cigarette and not packets of it. How is that encouraging people to smoke if people are buying single cigarettes, or loose straws as they call them?
Look, there are different points of view about single-stick cigarettes, and at the National Council Against Smoking, we haven't made a statement in opposition to the single-stick cigarettes, because we are aware that it is widely sold in that way. However, it is actually, when you sell sticks individually, you make the product more affordable. And when you make the product more affordable, it becomes easier for young people in particular to use the product, because they might not be able to find 25 or 35 Rand to buy a pack of cigarettes, but they can easily find 2 Rand or 2 Rand 50 to buy one.
All right, let me bring in Hayley Cimring from the Heart and Stroke Foundation into the conversation. Ms. Cimring, a very good evening to you. Thank you so much for speaking to us. Point of sale marketing is also another bone of contention. What would you like to see changed there?
Hi, yes, thank you for having me, and it's good evening to you and your listeners. As you were saying, the tobacco related industries really manipulate the youth, and I would really strongly like to see the bill passed. You know, it's been in draft for a while, and I think that once the bill is come into effect, we'll really be able to strengthen our tobacco control legislation. And I think that will help with all the marketing tools that they use against the youth too.
Litigation, is it successful in weakening tobacco control legislation or regulations? I mean, we've seen within this period threats to do so.
Sorry, can you just repeat the question?
I'm asking if litigation is an effective way of weakening tobacco control measures or regulations. During this COVID-19 period, we've seen threats thereof to force the sale of tobacco products back onto the market.
Yes, so we have, and up to this stage, it's still been unsuccessful. I know many people are struggling, and we do understand the difficulties and where these people are coming from, but we strongly support the government in a ban due to the fact that tobacco is harmful, and even the ingredients in vaping devices are known to be poisonous. So,
Ms. Cimring, when you say you do understand where they're coming from, where do you believe they're coming from, and what do you understand?
Well, I know specifically with the youth, about 60% of South African youth smoke their first cigarette in their teens, and we know that children and adolescents who use e-cigarettes at least double their chance of smoking cigarettes later in life, which then becomes a very hard habit to kick. Unfortunately, with the youth, the nicotine in the tobacco products can obviously permanently damage the developing brains of young people, and this is one of the dangers and this is why I think our theme, the World Tobacco Day, No Tobacco Day theme, is so relevant this year.
When you say you assume, or rather that you understand where they're coming from, it does assume a certainly empathy, understanding of their choice to smoke. But I'll move forward and ask this question.
Yes.
For those who justify smoking by saying it actually curbs less or more harmful behavior, let me rather state that it lowers their stress levels, it stops them from doing things that would be more destructive. What do you say to them who say that they smoke, quote unquote, responsibly?
Yes, a lot of people do say that, and what our aim is mainly to do is to educate the youth on the harmful effects of smoking, and then they can make their own choices based on an informed opinion, not an opinion that is really fed to them by industries which are driven only by profits.
Ms. Kalideen, let me come back to you. As you mentioned earlier on vaping, we've seen, especially amongst the youth, that it has taken off at rather alarming rates, and there have been inconclusive studies, unfortunately, as to the effects of vaping. Studies in India, for instance, have shown high levels of a respiratory illness and people being hospitalized as a result of vaping. How would you see the legislation being designed that not only do those who do take up vaping, for instance, learn what the harmful effects are, especially as the tobacco industry has presented its own studies saying that it is less harmful than smoking cigarettes?
Thank you. Thank you very much for that question. So the evidence of linking e-cigarette or vaping to health harm on a short-term basis is not inconclusive. It's actually very compelling evidence is available for even the very short-term use that we've seen, which is around a decade. You would know that last year, more than 1,500, young Americans under the age of 25 were hospitalized for serious lung diseases. They were in ICU for weeks on end. I think about 58 of them died from lung disease. And that is because of the effect of the propylene glycol, which is in every single e-cigarette or vape liquid. That is one of the components of the vape liquid. And so with this very short-term use, we've already seen damage to the cardiovascular system, which in the long term could lead to heart disease. We've seen the development of cancer in rats, so genetic change, which could lead to cancer in rats, which means in the long term we're going to see it in humans as well. That's what scientists expect. We've also seen an increase in respiratory illnesses. So the long-term effect of e-cigarette or vape use is not established because it hasn't been used for a long time yet. It's only been used for a decade. So we would need people to use it for 20 years for scientists to be able to tell us what the more long-term damage is actually going to be. So because of this knowledge that we already have from the scientific community about the link to health harm from the use of e-cigarettes and vape products, we support the introduction of regulation of e-cigarettes and vape products, which is in the bill that we were speaking about a few minutes ago. So for the first time, the marketing of these products will be banned, exactly as the marketing and sponsorship of tobacco products is banned. The producers, manufacturers will be required to write down the list of ingredients on the packaging. They will be required to give a health warning to tell consumers what to expect when they use the product.
Okay.
And the product is, of course, going to be taxed as well because of the health harm that it causes.
All right. Hayley Cimring, final question to you.
Yes.
We know, for instance, if you're talking about tobacco products, there is snuff, which is used by some for traditional or spiritual ceremonies. Are you saying that those two should be regulated or should be removed from sales options for tobacco companies or the industry?
Yes, thank you for the question, and that is a good question. Again, it's a very topical issue, and I think when we can look at it from two sides, but when we look at it from the health risks, we do support a holistic approach to it.
Unfortunately, we seem to be having trouble hearing the Hayley Cimring is from the Heart and Stroke Foundation. Savera, Kalideen also speaking to us there from CANSA. That's it for now. We'll take a quick break and we'll look at more stories around the world.